Hi everyone. Daria asked me to speak with you guys a little bit about the new Panda beds that you might have noticed in the ERs. Specifically, Glenbrook ER has a new one, Highland Park ER, and then Skokie has a modified version without the respiratory panel. I'm going to spend just a few minutes talking about what it is, how to use it, and then if you have any questions, feel free to reach out by email and circulate this video as widely as is helpful. So the Panda Bed is really a Cadillac of radiant warmers for infants, and depending on the components that you have, is completely sufficient for a neonatal resuscitation. I actually created a one-page document when we were going through the educational process for the ER nurses, and I'll make sure that this is available to you guys as well. But it goes through the indications for using the radiant warmer. I think what you'll find is that you'll be surprised that really you're probably using it more often than is safe or needs to be used. Safety tips and best practices in terms of how to rewarm a cold infant, and those are directly taken from what we consider the Bible for neonatal medicine, the 7th edition, which is the current one of the Lang. And then some quick tips if you get a heads up from EMS that they're bringing a woman in who's imminently delivering, things to remember, some safety parameters for the resuscitation itself, since everybody could use a just-in-time reminder. So, as a reminder, Evanston Hospital still utilizes an Ohio radiant warmer, which is the older version. The idea being that if you are in the position where you're really resuscitating a neonate there, you're probably calling on our level 3 ISCU neonatal providers to come help you, and they can resuscitate with any equipment, and they themselves have not updated what they are utilizing in the term delivery rooms at Evanston Hospital. In the level 3 NICU themselves, they actually utilize for micropreemie something called a giraffe bed, because in peds we name everything after cute animals, and a giraffe bed is like a Panda except that it has a housing unit that will come down over top of the neonate and serve as their isolette too. From birth, from the delivery room, we try not to move them again until they're stable enough to come out into a standard isolette. So first things first, this is your Panda Bed. I'm going to show you first how to operate it, and then things that would be helpful during a resuscitation. Turn it on here. If I'm getting ready for a resuscitation, I'll also turn on my suction, my resuscitation ventilation circuit, and then you have 3 knobs down here, maybe 2 if you don't have the T-piece resuscitator, that are for liters per minute, and we're always using between 8 and 10, and then our blend of oxygen from 21 up to 100. For the most part, in deliveries, we're starting with 21% oxygen. Obviously, if you have a baby coming in who's in distress with a respiratory illness, you're going to be bleeding up higher to the higher FiO2s. This dial here is actually regulating your PIP on the T-piece resuscitator, and I'll talk about that specifically in a minute. These Panda beds have the capability to hook directly into your medical air and oxygen in the wall, and that's the preferred setting, but they also should have tanks on the back of them so that if you were transporting, moving, needing to utilize a space that's not got wall air, that you can do that as well, and your RT should be aware, as well as your nursing should be aware of how to open that up and make sure it's full for you, and you have pressure gauges down here to see whether it's full or not. Up here on your interface, you can hit admit a baby to start to control what your radiant warmer settings are. So I think initially it will turn on in 100%, and that's a preheating mode. You're never again with a child on here going to use it in 100%, incredibly unsafe. So you're going to decide whether you want to be in manual mode or baby mode here. Baby mode is a servo mode, means you're going to have a probe, a heat probe on the infant with a reflective sticker, and that it's going to regulate to the infant's surface temperature. On this sheet, I've included some parameters of what we should be heating to. I can turn off the alarms by waving here or hitting this yellow button here. And then in servo mode or baby mode, it'll regulate the output based on what your goal surface temperature is. There is a pulse ox in the bed if you have it with all the bells and whistles, as Glenbrook and Highland Park do. You'll hook in your pulse ox here. Obviously, you know how to put it on a baby, and then you can adjust the settings, making it very sensitive or normal sensitivity for you. You're going to use it in normal sensitivity for the most part. We use maximum sensitivity in an actual delivery, but you're going to get a lot more warnings that way. It'll read you a pulse rate directly on here as well. You'll get a waveform, really helpful. And now just a few other quick things. If you find yourself actually resuscitating a baby on this, just remember you want the head down here, because you're going to be head of bed as the provider here. All these sides open up for free access to the infant. If an infant's old enough to roll over, they should not be on this platform. You can adjust the height of the bed to be comfortable for you as the head of bed airway person with these electronic paddles on the side. Can go very low as well. And then you lift an edge and drop it down in order to have access. So just, you know, these are really expensive. Make sure you're not just ripping it down. You have to lift first, then lower it. When you move into the head of bed position and want to test whether or not your resuscitating piece for ventilation is safe, this is what it looks like. You can put any mask on it. You'll see that it has a dial for the PEEP here, and you're going to be looking at the PIP on the manometer on the bed itself. If I occlude the mask, either on a face or my hand, it'll read out what my PEEP is. Right now this says 4 to 5. If I want it to have more, I turn it up, less, turn it down. And then to adjust my PIP, so if I occlude the top of this, it's hitting 20. That's actually what we're going for to start. Obviously you want to use as little pressure as possible to move the chest. And so right now, this will provide BiPAP. So as I compress, I get my PIP, I let go, I have my PEEP. If I want more PIP, if I'm not getting good chest rise, I can turn it up here. If I turn it all the way up to the yellow dial, obviously that corresponds to a PIP of 30. If you have a really rigid chest wall, really sick kid, you can override that, but you have to do it manually by pushing in the yellow and going beyond to get those higher pressures, recognizing that you're probably going to cause interstitial emphysema or a pneumothorax, but that's what you need in that moment to actually resuscitate that child. So we keep the flow at 8 to 10 liters and adjust our PIP from here on this. These T-piece resuscitators are pretty unique to the Panda and to neonatal resuscitation, but have been demonstrated in the last few editions of the NRP or neonatal resuscitation program to be the safest for people who don't resuscitate neonates all the time. When our neonatologists actually show up to help with the resuscitation, they probably still are going to prefer to use the anesthesia ruche bag, and notice that neither of the preferred methods are really the ambu bag that we commonly use in older kids. So with the ruche, you have to have a separate manometer, or the ISCI may bring their own, and this is seal dependent to have enough flow, and you're following this manometer here for your PEEP and your PIP. But still keeping it at 8 to 10 liters, and again, occluding the mask, you can see what PEEP you're delivering, and you're still aiming for breaths of 20 over 5.
Okay.
So the suction option for you that's directly within the bed should default to being safe in level, but when you occlude the end of your suction tubing, you want to be in the green zone. We really want to be between 80 and 100 so that we're not causing trauma to delicate tissues. Again, you can turn it up, you can turn it down, but effectively you want it to land closer to 80, between 80 and 100. Just a few other helpful features. You'll notice that you have a general overhead light here that you can dim all the way down, all the way up, depending on how much lighting you need generally on the bed. And then this is a spotlight specifically for procedural-based things, so you can aim it. We use it most commonly for when we're placing an umbilical line. Lastly, you have drawers that open bidirectionally on either side of the Panda, and in the ERs, these have been stocked with the things that we think you'll need most likely in a rapid, unexpected birth. This particular bed is set up in labor and delivery, so I'm not going to bother to go through the equipment, but get to know what is in yours.